The broadcast is now starting. All attendees are in listen-only mode.
Hello, and thank you for joining us for part 4 of our 5-part board certification brick by brick series. Today's presenters are myself, Donna Sarvello. I am the VP of Educational Support with NCBTMB. I've been in the massage profession for over 20 years. I worked as a massage therapist for physical therapists and chiropractors. Then I taught, and now I've been with NCB for 10 years. Joining me today is Matt Gavzy. Sorry, Matt. Matt, tell us a little bit about yourself.
Hi, Donna. Thanks for having me here today. I have been a massage professional for over 25 years, and I've been board certified for, I believe, 24 of those years. I am also an NCBTMB continuing education provider. I am also a licensed physical therapist assistant, and I work in different settings such as subacute, long-term care, and outpatient facilities.
Excellent. So, Matt, tell us the benefits of board certification.
There are a lot of benefits to being board certified. It can allow you to attract more clients because your clients will know that you take your massage profession very seriously, that you are not just an entry-level massage therapist, but you have taken advanced classes to further your own education. It allows us to integrate well with other healthcare providers so that we can communicate with them. They know that with that board certification behind us, they can take us more seriously and be more comfortable in referring patients to us. Gains distinction in your own network. So again, your network of your physical therapists, chiropractors, doctors, they believe you when you have that board certification, that you really do understand what the pros, the cons, the benefits, the real effects of massage and how it works. The NCB gives you access to great quality continuing education that has been seriously vetted for quality and content so that you know what you're getting is going to help improve your techniques and improve your knowledge. It also allows you to become more versatile and successful. Through all of those other things, you can't help but become more successful as a massage therapist.
Yeah, and medical professions do understand credentials.
They do. That is a very, very good point. You know, being able to have that credential behind your name in the medical profession does hold value and weight. You know, the physical therapist who has different credentials behind their name, different specialties, they're looked upon differently. So as a board certified massage therapist, you are looked upon differently having that credential behind you as well.
Perfect. Can you tell us a little bit about the different modalities, techniques, and forces that massage therapists use?
Absolutely. There's a number of different techniques and forces that we as massage therapists will use, and understanding them is really, really important. So we all understand about tension, right? So tension in the body and how that affects us, we understand that. But using tension in your massage is different. It's being able to use compression and decompression. Compression is how much force you're putting into the body perpendicular, whereas decompression is more of a distracting force. So if somebody has arthritis in their hip, I can use a gentle decompression or distraction at their ankle to help unload their hip a little bit, bringing them relief. Shearing and gliding are forces that are not perpendicular to the body. So they are running in different angles to the body, and they have their own neurological impacts. lifting and kneading. Some of us may know that from our Swedish backgrounds as petrissage. Bending. Bending is what we do when we do range of motion, flexion, extension, rotational movements of joints. So those are important. Torsion is also important. Rolling and percussion. Percussion is a great modality, especially if you're dealing with somebody who has some lung issues and they need to have the phlegm in their lungs loosened up a little bit so that they can expectorate it.
Excellent. So, why is it important to use current terminology in our profession?
That's a really great question. Using proper terminology or current terminology allows us the ability to communicate with different people on different levels without either making them feel as if we're talking down to them, or allows us to show that we truly do understand what it is that we are talking about. So if I'm talking with my client, I want to be able to talk with them in a manner that makes them more comfortable. I want to be able to use terminology that they can understand, and without talking down to them. Nobody likes, the idea of being talked down to, especially a client. Talking with other massage therapists, being able to understand what they're dealing with a client, especially if they refer somebody to us. We need to be able to understand our anatomy and physiology and be able to work with that so that we can give the best results to our patients or somebody that's been referred to us. If I'm speaking the language with a healthcare professional, they use proper terminology all day in talking with colleagues, in talking with other professionals, in the notes that they write. So using that terminology is really, really important, because it also allows us to pinpoint where a specific problem is or a specific part of the body that somebody is talking to us about, whether we're using proximal and distal, lateral and medial, or any other types of terminology. These words allow us to pinpoint where the problem is with somebody and then be able to communicate that back to other professionals. And remaining up to date in terminology is important, because massage is beginning to do or get involved with research more and more on a deeper and deeper level. And research articles in journals are written using proper terminology. And so us as massage therapists, to be able to really glean the most from those articles, we need to be up to date in understanding the terminology as well.
Exactly. I remember once when, well, not once, a couple times, I've had different chiropractors and physical therapists on my table. And another important thing to keep in mind is that if you do have medical professionals on your table, you might want to speak to them in proper terminology so they trust you more. So you wouldn't speak to a client who's a physical therapist the same way you might speak to someone who is a stay-at-home mom or anything like that. We want to make sure that we match the terminology of our clients.
Absolutely. That communication part is so key for any healthcare professional. And so being able to use those terms are absolutely right. I couldn't agree with you more.
Perfect. Okay, can you tell us some information about these different advanced techniques and how they're used?
It would be my pleasure. It's a great question. When we're talking about these advanced techniques, it's really using different basic techniques together to create these advanced techniques. So proprioceptive neuromuscular facilitation, we may know as contract, relax, stretching. In terms of, if I want to gain a greater range of motion in somebody's hamstring, let's say, I may have them create an isometric contraction against my hand, but it doesn't have to be a forceful contraction, just enough that the muscle gets engaged And then when they relax, I might be able to get further and a deeper stretch into the muscle belly. In terms of physical therapy, we use proprioceptive neuromuscular facilitation, or PNF, as an exercise. So if somebody's having shoulder or hip problems, we can do diagonal pattern exercises with these people to be able to build strength, create greater range of motion with greater ease. Myofascial release kind of works with something else called DNM, or dermoneuromodulation. Excuse me. Both of these techniques use gliding forces to help bring about neurological changes in the patient. So myofascial release uses a deeper pressure, and DNM, or dermoneuromodulation, uses a lighter pressure, but both again use this technique to flood the brain with a signal that allows the body to then relax. Pin and stretch is excellent when working with an athlete. If somebody seems to be getting stuck, or as you're going through a stretch with them, if they're telling you that they're having pain at this one part of a stretch, we can actually pin down the muscle or create pressure at that muscle or just below it, so that we kind of create a shortened muscle, so that we can create a deeper stretch from that point forward to help break up or loosen up whatever that tight area is. Muscle energy techniques use a combination of different modalities like positional release, stretching, contract, relax, to create change within the body. I find that technique works really, really well with some people who are having some low back and hip issues. Orthopedic massage or orthopedic techniques deal with the body's locomotor system. So anything that creates movement, whether it is bones, tendons, ligaments, muscles, nerves, fascia, things like that, this technique these techniques can really help create greater movement for our patients and clients. Hydrotherapy is using water in its different forms, whether it is warm water, a hot pack, or cold water or ice, to create change. So we know that ice has the property of vasoconstriction, and heat has the ability to vasodilate. So using them in conjunction, we can kind of create a pumping effect to help move, what's the word I'm looking for? Fluid in and out of the muscle to create a pumping effect. And manual lymph drainage is a very soft, light touch technique that helps to drain lymphatic fluid on a superficial level, so that if somebody has a lot of swelling, we don't want to go in and press hard, but there's still ways that we can help the body to drain that fluid from that limb and get the body to deal with it and move it out.
Absolutely. And I just want to point out to all of our listeners that all of these are continuing education courses, and you want additional training before practicing any of them. And then Matt, what is your favorite technique?
Well, I think being a physical therapist assistant and having dealt a lot with athletes, my favorite is definitely the orthopedic techniques. So I also have a continuing education class that deals with orthopedics. It's an 8-hour class that is approved for continuing education, that talks about different injuries or different pathologies that somebody might have and what surgeries they may need to have to correct those pathologies, but then we as massage therapists need to know and work with that population on what we should or shouldn't be doing so that we do no harm. So this class begins to close that educational gap between what an entry-level massage therapist would learn and even an entry-level physical therapist assistant learns. So, because I do believe that there is definitely an educational gap between those two. So this class begins to bridge and close that gap.
Excellent. So, how do different techniques manufacture different results?
That is a great question. The different techniques that we use can help us to create treatment plans by using them. So if I have somebody who is not responding to one technique, I hopefully have another technique that I can use that will either be more comfortable or more beneficial for that patient. Our plan of cares should be fluid. I should be able to change it effectively and efficiently, whether it's on the fly or between sessions. So if I have different techniques, I can definitely have better plans of care. Understanding different techniques and different strokes allows us to have a deeper understanding of the mechanical, physiological, and neurological effects of what those techniques do to the body. So if I can match the technique with the pathology that somebody is presenting with, I know that I can have greater results in a shorter period of time. And being able to apply those different techniques to address those different pathologies is really important. So if somebody is coming in with a potential stress fracture because they've had shin splints for a long time, and maybe that shin splint is coming from a possible stress fracture of the tibia, I am definitely not going to be doing anything right over that bone, and understanding that is important. And I'm going to work somebody who has a sprained ankle differently than with somebody who's presenting with Parkinson's or with some other neurological issue or a cardiac patient even. So understanding the techniques, having those techniques allows me to address different populations of people and different pathologies better.
Do you think it's better for people to have several techniques under their belt, or is it better to concentrate on a couple and become a perfectionist or excellent in a couple?
I think the best answer that I can give to that is it depends. I think it depends upon the population of people that you want to work with. So if I'm going to work mostly with, let's say, the geriatric population, I'm going to want to become very proficient in certain techniques. The same would hold true if I'm going to work with pregnant people or people who have different neurological issues. So I think it really depends. Different populations require different techniques. So if you're going to specify or really want to work with one population, then I think having fewer techniques is okay. But if your practice is going to be something more general and you're going to work with a lot of different types of people, then I think having more techniques is better.
Great answer. So you're moving us into special population. Can you tell us a little bit about these different populations and how you would work with them and what's so special about them?
Yeah, different populations definitely require different types of techniques and everything. So if I'm dealing with somebody who is pregnant, then I'm going to want to make sure that I am positioning them properly using bolsters and things and different positions so that they are most comfortable. Because what's comfortable for them can be different in different stages of pregnancy. And just because somebody's pregnant, I'm not going to rule out that they want only light or only deep pressure. So things like that are very, very important. Can they lie prone today? Can they not lie prone? So I need to make sure that I can do that. If I'm dealing with somebody who is geriatric, I have to make sure that they can get on and off the table properly, or go from supine to sit or sit to supine properly. So I may have to be willing and able to position them well or give them assistance. I'm also going to make sure that I probably don't do anything very deep, or very rough, because their skin can be so thin. So I need to be cognizant of those things as well. If I'm dealing with somebody who is going through chemotherapy, unfortunately for cancer, I need to understand that massage is a systemic modality in and of itself. So there could potentially be adverse effects of doing massage on somebody who is going through chemotherapy. So it's very important for me to check in with them, check in with their doctors to make sure that I get the proper clearance and working with them. And one day, one technique may work well, one day another technique may not. So I have to always be checking in. If I'm dealing with somebody who has diabetes, that's a very unfortunate disease, and we know that there's type 1 and that there's type 2. Somebody who is diabetic is automatically also considered a cardiac patient. So I have to keep that in mind. And people who are diabetic can develop something called diabetic neuropathy, where they may not be able to feel what's going on in the bottoms of their feet, or they have pins and needles to an excruciating level in their lower extremities or their feet. Unfortunately, with this diabetic neuropathy, these people can very easily develop sores as well, because they can't feel when they get an infection, or they get a cut in their foot. So we have to be very, very careful when working with this population. And somebody who has multiple sclerosis or MS, and a very unfortunate upper motor neuron disease that affects not only their nerves, but it ultimately affects muscles as well. So the person may be bedridden, the person may be confined to a wheelchair, they may be in early stages of MS and are fine. So we need to understand where their lesions are, if their lesions are in their brain or in their spine, and understand where they are and what type of multiple sclerosis they have, whether it's progressive remissive, where are they just in remission, or are they going through a progressive bout at the moment? So understanding these diseases and these populations really can help us provide the best care and do no harm for our patients and clients.
Excellent descriptions. So, how do we alter massage for special populations?
Yeah, that's a great question, because a lot of people, unfortunately, don't realize that you do need to alter your massage when dealing with a special population. So understanding what your indications and contraindications are with somebody. So again, if I'm dealing with a geriatric patient, I'm not going to do a lot of deep gliding or shearing work, because I may, give them a skin tear. Their skin is so thin and fragile. I need to make sure that I'm using more, lubricant than what I might be used to doing, just to make sure. And they also can bruise so easily, especially if they're on a blood thinner. So we have to be very, very careful. We need to be careful if somebody needs to be positioned differently, or bolstering, like I said, with somebody who is pregnant, I'm going to have a lot of bolsters around and pillows so that the baby can be well supported and the mother can be very comfortable. And the position that's most comfortable for them may not always be the most comfortable for us to work as a massage therapist. So we have to, you know, find a way where it's good for them and good for us. But ultimately, the massage is for them, and we need to take care of them. And you know, if I'm dealing with a pregnant woman and I hit that spot, they may just say, you know what, just stay there for a moment. You know, I need more or less pressure in that one spot, but just hang out there for a moment because that's making me feel really good. Everything is beginning to calm down. And I have to be willing to alter my massage to give them what they need at that moment in time. If I'm dealing with somebody who has diminished mobility, you know, I may need to work with them in their wheelchair or in their bed, or be able to help them on and off the table. Or, you know, somebody who has Parkinson's, you know, they may be able to move, but it may be a very uncoordinated, or what we call a dyskinetic movement. And I have to be able to help them and understand that it may just take them longer to do things. So all of these things, being cognizant of, allow us to alter the massage so that we can truly help these people of special populations better.
Excellent. So thank you for joining us. To contact us for more information, you can go to the NCB website at www.ncbtmb.org or call our 1-800 number. You can email us at info@ncbtmb.org, or you can find additional resources for our board certification at shop.ncbtmb.org/forms tools/. Well, Matt, thank you for joining us. This was excellent. I love when people explain to our massage therapists the need for the different techniques and information. This was great.
Well, thank you for having me. I do appreciate it. It was truly a pleasure speaking with you.